Aspirin, also known as acetylsalicylic acid, is a widely used medication with various pharmacological effects. 1. Analgesic pain relief. Aspirin reduces pain by inhibiting the production of prostaglandins, which are chemicals that promote inflammation and sensitization of pain receptors. 2. Anti-inflammatory. It has anti-inflammatory properties by suppressing the production of prostaglandins, thus reducing inflammation and swelling. 3. Antipyretic fever reduction. Aspirin helps lower fever by acting on the hypothalamus, which regulates body temperature, and reducing the production of fever-inducing prostaglandins. 4. Antiplatelet. Aspirin inhibits platelet aggregation, making it valuable for preventing blood clot formation. It's often used as a blood-thinning agent to reduce the risk of heart attacks and strokes. 5. Cardiovascular effects. Aspirin can reduce the risk of cardiovascular events by inhibiting platelet aggregation and potentially reducing inflammation within blood vessels. 6. Metabolism. Aspirin is rapidly absorbed in the stomach and metabolized primarily in the liver. 7. Excretion. It is excreted mainly through the kidneys as salicylic acid and its metabolites. Pain relief and fever reduction. Adults, typically. The usual dose for pain relief and fever reduction in adults is 325 to 650 milligrams every 4 to 6 hours. As needed, do not exceed 4,000 milligrams for grams per day. Antiplatelet heart health. Low-dose aspirin 81 milligrams or 100 mg is often prescribed for heart health and to reduce the risk of heart attacks and strokes. This is usually taken once daily under the guidance of a healthcare provider. Aspirin is generally well tolerated when used as directed, but it can have some common side effects. These side effects may include 1. Gastrointestinal irritation. Aspirin can irritate the stomach lining, potentially leading to symptoms like stomach pain, indigestion, heartburn, or nausea. Taking aspirin with food or using enteric-coated aspirin may help reduce this risk. 2. Increased risk of bleeding. Aspirin has blood-thinning effects, which can increase the risk of bleeding, including nosebleeds, bruising, and prolonged bleeding after injuries or surgeries. 3. Gastrointestinal bleeding. In some cases, aspirin can cause gastrointestinal bleeding, which may manifest as dark or bloody stools or vomiting blood. This is a serious side effect that requires immediate medical attention. 4. Allergic reactions. Although rare, some individuals may be allergic to aspirin and experience symptoms such as hives, itching, swelling, difficulty breathing, or a severe skin rash. Seek immediate medical help if you suspect an allergic reaction. 5. Tinnitus, ringing in the ears. Aspirin can occasionally cause ringing in the ears tinnitus, which can be temporary or persistent. If you experience this, consult your healthcare provider. 6. Liver and kidney issues, long-term. High-dose aspirin use can potentially affect liver and kidney function, but this is less common and often occurs with excessive or prolonged use. 7. Ray's syndrome in children and teens. Aspirin should not be given to children or teenagers with viral infections due to the risk of Ray's syndrome, a rare but serious condition that affects the liver and brain. 8. Asthma exacerbation. Some individuals with asthma may experience worsening of their symptoms when taking aspirin. This is known as aspirin-exacerbated respiratory disease (ARD) and should be discussed with a healthcare provider. Aspirin can interact with various medications and substances, potentially affecting its effectiveness or increasing the risk of side effects. Here are some common interactions to be aware of. 1. Anticoagulants, blood thinners. Combining aspirin with other blood-thinning medications like warfarin, heparin, or newer anticoagulants e.g. apixaban. Rivaroxaban can increase the risk of bleeding. This combination should be closely monitored by a healthcare provider. 2. Antiplatelet drugs. Taking aspirin with other antiplatelet medications like clopidogrel Plavix can also increase the risk of bleeding. This combination is sometimes prescribed but should be managed by a healthcare professional. 3. Nonsteroidal anti-inflammatory drugs, NSAIDs. Using aspirin together with NSAIDs like ibuprofen or naproxen can increase the risk of gastrointestinal irritation and bleeding. It's generally advisable to avoid this combination, but if needed, consult a healthcare provider for guidance. 4. Corticosteroids. Aspirin can enhance the risk of gastrointestinal ulcers and bleeding when taken with corticosteroids like prednisone. 5. Alcohol. Combining aspirin with alcohol can increase the risk of stomach irritation and bleeding. It's advisable to limit alcohol consumption when taking aspirin. 6. Certain medications for high blood pressure. Some blood pressure medications, like ACE inhibitors and beta blockers, may have their effectiveness reduced when used with aspirin. Consult your healthcare provider for guidance if you are on these medications. 7. Methotrexate. Aspirin can increase the levels of methotrexate in the body, potentially leading to methotrexate toxicity if you are taking methotrexate. Discuss the use of aspirin with your healthcare provider. 8. Selective serotonin reuptake inhibitors, SSRIs. Combining aspirin with certain SSRIs used for depression and anxiety can increase the risk of bleeding, particularly in the gastrointestinal tract. Inform your healthcare provider if you are on an SSRI. 9. Herbal supplements. Some herbal supplements, like ginkgo biloba and garlic, may also increase the risk of bleeding when combined with aspirin. Discuss the use of herbal supplements with your healthcare provider.